Hi there, I'm Dr. Lynne Murfin and I'm a functional integrative physician. My practice is in Calgary, Alberta, Canada. I graduated from medical school in 1988 from the University of Cape Town in South Africa, and I've been practicing family medicine for about 25 years now. I am incredibly passionate about functional integrative medicine because it's given me a new lens in how I can view my patients. I was in the trenches for 25 years and loved what I did, but became a little frustrated at some of my outcomes, especially with the up-ramp of chronic complex disease. But now that I've been using functional integrative medicine, I have a new paradigm, a new toolkit, if you like, to actually dig deep and go upstream and find where processes are problematic, and get the milieu right and heal the patient with extraordinary outcome. My practice is very broad-ranging. Patients come to me who are perfectly well but want to maintain their vitality and achieve longevity and have good outcomes. And other of my patients are very sick, often suffering from things like chronic fatigue syndrome and fibromyalgia. One of my areas of greatest passion is still my preconception patient population, and also my infertility patients. I love doing work in patients who hope to achieve or enhance their fertility outcomes. We always start with nutrition. Food is first, and I encourage my patients to embrace a 12-week therapeutic lifestyle change program that I have in place in my practice, where we educate the patient deeply about the latest research in foods that are anti-inflammatory. So we begin with food first. After that, we do a thorough assessment of their nutrient levels and also their metabolic processes. I do a lot of work with individualized biomedical markers. Looking at the patient's environmental milieu is absolutely critical. It's important for us to even talk about the water that the patient is ingesting. Is it alkaline? Is it ionized? Are there filters on the tap water? What are they immersing themselves in on a daily basis when it comes to cosmetics, perfumes, clothing, dry cleaning? So yes, toxicants and toxins are an important part of our discussion. Detoxification and biotransformation is one of the most exciting areas in the post-genomic era. We are now able to actually evaluate somebody's individual genetic ability to detoxify certain substances and not others. It truly is groundbreaking. We're then able to actually move patients, for example, if they have an issue with estrogen, we can move their pathways in the direction that leads to a decreased risk of prostate or breast cancer. And often we do this by using foods like the fabulous cruciferous vegetable family. Brussels sprouts, broccoli, bok choy, cabbage, just absolutely amazing at upregulating those good pathways and downregulating those bad pathways to assist with detoxification. I refer a lot of my patients to the Environmental Working Group. It's a non-biased website and it's fabulous to keep up to date on the Clean 15 and the Dirty Dozen. BHRT plays a very significant role in my practice, but always in the context of making sure that the patient is nutrient repleted first. When we look at hormones, we look at them by using salivary, urinary and serum modalities to establish a really good baseline of where that patient is, whether they be male or female. We also always look at their pathways. How do they eradicate or remove the estrogens from the body, and how can we improve that? So yes, it plays a very big role in achieving optimal vitality and wellness. In medicine, you simply can't just look at numbers. One has to have a look at what's happening spiritually and also at an emotional level with that autonomic and central nervous system. In the practice, we measure sympathetic and parasympathetic balance with heart rate variability testing. And we do a lot of work in helping to modulate the autonomic nervous system, looking at balancing stress and that very good and calming parasympathetic nervous system that is so soothing. So I do encourage a lot of my patients to use modalities like lavender Epsom salt baths and yoga, mindfulness meditation, and lead them toward Jon Kabat-Zinn's work. If you'd like more information about our practice, please feel free to go to our website. We'd love to hear from you.